A Cesarean Birth Story. Despite increasing efforts to reduce surgical births, nearly 1 in 4 babies is born by cesarean in many parts of North America. That is why it is important for you to explore the possibility that you may experience a cesarean birth. Preparing for childbirth and using labor techniques you've already seen in this film help reduce the chances of a cesarean delivery. But sometimes, even after trying many alternatives, surgery is necessary. While most first-time cesareans are not planned, certain medical circumstances do require surgery to be scheduled before labor begins.
Hi, could you tell us where the meeting is, please?
Karen and Paul knew in advance that their baby would be born by cesarean because ultrasound showed that the placenta was blocking the opening of Karen's cervix, a condition called placenta previa. So unlike most people who experience cesarean birth, Karen and Paul had time to prepare themselves. Still, Paul was a little nervous. He had taken a special cesarean birth class and knew he wanted to attend the birth, but he'd never been near an operating room before, and certainly not with his wife as a patient.
Are you getting nervous?
Yes.
It was reassuring for both Karen and Paul to have a little time before the surgery, to become familiar with their surroundings and to get to know some of the staff. An hour or so before birth, a nurse began preparing Karen for surgery. She listened to the baby's heartbeat, took Karen's pulse, temperature, and blood pressure. A catheter was placed into Karen's bladder to keep it empty during the operation. Finally, Karen's abdominal area was washed and shaved.
Do you have any questions about what's going on that I haven't covered, or any concerns that you have?
Oh, I don't know. I guess I'm just thinking this is it. This is getting close. You know, when all this stuff's happening.
It'll be over soon.
I'm thinking, yeah, pretty soon it'll be over.
Hi.
How are you, Doctor? Nice to meet you.
You're Dr. Albert's patient. I just told me all about you.
Dr. Levereau, the anesthesiologist who would be with Karen and Paul in the operating room, met with them to review Karen's medical record.
I just want to ask you a few questions before we get going as far as pertinent medical history and things that are going on with you.
And then
Dr. Levereau then described the epidural block, the safest method of anesthesia for mother and baby, which would allow Karen to be alert and responsive when her baby was born. Then he described how the medicine would work and its possible side effects.
Just relax. Breathe
A lot
nice.
of pressure.
Big deep breaths.
Deep
How tall are
breaths.
you, dear?
Paul helped Karen remember the breathing patterns they'd learned in class, while Dr. Levereau administered the epidural.
Just relax.
Lots of pressure.
Just relax. Breathe slow. In through your nose, out through your mouth.
After the epidural catheter was in place, Karen's obstetrician, Dr. Albert, came by.
Okay. What's going to happen now is that we're going to bring you over to the operating room, okay? And Dr. Levereau will dose your epidural even further than he has already. And we'll check it and make sure we have an adequate level and you're not feeling very much. You won't be feeling very much anyway.
Dr. Albert gave the reassurance that he and the medical staff would do all they could to make the birth the special event Karen and Paul wanted it to be. Now all they felt was excitement. At last, Karen made the long-awaited trip to the labor and delivery operating room. Paul was already in scrubs and only had to put on his mask and hat before entering the surgical suite.
Now, Paul, we're going to have you. You going to watch?
Yeah.
Okay. I want your support here.
Yeah.
You just sit down. Anything past this, you can't touch.
Right.
You can touch her all you want.
In the delivery room, a fetal monitor kept constant track of the baby's well-being, and Karen continued to receive IV fluids. An anesthesia curtain was draped across her shoulders, creating a sterile field, and a blood pressure cuff was attached to allow for continuous monitoring. Dr. Albert washed Karen's abdomen with an antiseptic solution called betadine. The number of medical staff present surprised Karen until she realized that each person had very specific responsibilities. Her own obstetrician would perform the surgery. A second physician assisted him, and helping them both were 2 operating room nurses. In addition, a pediatrician and nurse from the newborn nursery were on hand to examine the baby immediately after birth.
I'm going to be testing you here. Do you feel anything?
I feel you poking.
You're gonna
I
feel
don't feel
pressure.
anything sharp. I feel you poking.
That's one thing about epidurals, you do feel pressure.
Right.
The best thing I can compare to is like when you go to the dentist.
Yeah.
It's just like that you feel the pressure when they're working, but it doesn't
Right.
bother you.
Throughout the procedure, Dr. Levereau monitored Karen's vital signs, but in many ways he was also Karen and Paul's guide, letting them know what was happening and giving them reassurance.
How you doing? You're doing great, hon.
As the operation began, Karen could hardly believe the time had come. Soon their baby would be born. Paul, although excited, was also feeling concern for his wife and his child. He knew it would be only minutes from the first incision to the birth. Still, it seemed like forever.
Karen, we're just about to make the incision in the uterus.
Dr. Albert explained to Karen that he was making the same low transverse incision on both her abdomen and her uterus.
You're doing super. Get any names picked out? You know if it's a boy or a girl?
Well, I'll just answer as boy.
You're going to feel a lot of pressure.
Okay, we're going to put some pressure.
Yeah.
And the baby's head is now out. Dad, what do you think?
Yeah?
Look at that hair.
Oh, God.
Light.
Oh,
Light
beautiful.
hair.
Oh.
Yeah.
Beautiful.
Shoulder, the hands are out, and a screaming baby boy. Congratulations.
She's beautiful, hon.
Congratulations, hon.
That's great. Yo, he's beautiful. He's beautiful.
Beautiful baby.
Yeah, beautiful.
Birthday, huh?
Boy. Oh, what a big boy.
Congratulations. Happy
Thank you.
birthday.
See? Say hi, Nick.
Once Nicholas was born, he was examined by the pediatric staff. Then Paul could hold him while Kay looked on. It takes a full 30 or 40 minutes after birth for surgeons to complete the repair of the uterine and abdominal incisions. During that time, it is not unusual to experience nausea or chills and shaking. Medications are frequently offered which alleviate these symptoms, but they may also induce drowsiness, and many women prefer to be awake and alert during their first moments with their baby.
Oh, hey, baby.
He's a big boy.
If yours is a cesarean birth, keep in mind that in addition to having a baby, you will also have had major surgery. You will probably be in the hospital for 4 days, and you'll need help caring for your baby at home for at least 2 to 4 weeks while you take it easy. During your hospital stay, take some time to learn ways to help the recovery process along. For instance, if you are breastfeeding, you can become familiar with ways of holding your baby that reduce pressure on your abdomen. If your baby is born by cesarean, you may have the operation after you've been in labor for some time, unlike Karen and Paul. And the surgery itself is exhausting, physically as well as emotionally, especially when it is unexpected. Feelings of anxiety, confusion, or disappointment are only natural when the unexpected happens. But if you prepare ahead of time for the possibility that you may have a cesarean, there will be fewer surprises. And if surgery does become necessary, you can help to make the experience the very positive and fulfilling birth every parent hopes for.
Hey, baby boy.
As the work in birth ends, a new life begins. At last, relieved and full of wonder, you and your baby are face to face. Now he delights in your voices, and in your arms he rests safe and secure. Feelings you can hardly put into words make this moment unforgettable, a time in your life filled with special meaning. And as concerns about labor and delivery fade away, the bond between parent and child begins to take hold. In the quiet, deeply personal time following birth, you can take pride in your achievement. You can share hopes and dreams that may have gone unspoken before. And with each look, with every touch and smile, you can begin to feel love.